I want to welcome everyone, and it's certainly a real pleasure for me to give this presentation. I think especially after returning from our annual meeting. Those of you that are listening to this webinar and you did not attend the annual meeting, you missed a great event. Roger Morrison gave an amazing presentation, but I think more importantly, it was the camaraderie of all the people that were there and just sharing stories and just coming together again, which I think is so important in our community. And Roger said something that really impacted me. He said, homeopathy will succeed if there is 50 well-qualified homeopaths. And I immediately said to myself, oh God, I hope I'm well-qualified. People come to me, they're going blind, and I really know that homeopathy can help them. And so it's really been a passion of mine for well over 20 years, learning as much as I possibly can, utilizing homeopathy in treating my patients. And, with my practice, I do other things besides homeopathy. I do microcurrent, I do light therapy, I do nutritional consultation, but my main modality is homeopathy. Everybody gets a homeopathic remedy, whether they want one or not. So that's part of the whole process when you see me. So we're going to talk about an eye surgeon's discovery of homeopathy. A little bit about the history of ophthalmology and homeopathy, which is kind of interesting because in the late 1800s and early 1900s, the majority of ophthalmologists were homeopathic doctors, which is kind of surprising. I'm going to talk a little bit about my remarkable cures using homeopathy, which to me is what gives me passion for using homeopathy. Just seeing someone not only have their vision restored, but changes in their life just make everything worthwhile. And I think Roger made the comment, if we truly help one person changing their life, then all our years of study are worth it. And I agree with Roger. So also, what is treatable using homeopathy? And by treatable, I'm talking about ocular conditions. And one of the goals I'd like to achieve for those of you that are listening, I never want any of you to say, you get a phone call, they have macular degeneration or glaucoma, and you tell them, well, homeopathy can't help that condition. I think homeopathy can help any condition. And that's what I want to underline 3 times. It can help any condition. So I had an adventure last year. My wife and I did the Great Loop. Great Loop is a 6,000-mile ocean voyage. We started in Florida. We navigated up the East Coast. Then we went up the Hudson River. We did the Great Lakes, and then we navigated. We were thinking about going to Montreal, but that was a little bit out of our way. But my wife speaks fluent French. She lived in Paris for a while. We almost made it up to Montreal. Then you head down to Mississippi, cross the Gulf of Mexico, back to Florida. And that's a picture of our boat. But while I was on the boat, I was still doing homeopathic consultations, and I was working on my book, Homeopathic Ophthalmology. So this is the view from the bow of our boat. Of course, we love it when the water is this calm, but we almost lost our boat crossing Lake Michigan. We got caught into a really severe squall. And there's a couple more pictures. And this is the book that I'm working on. I'm probably going to finish this book at the end of the year. I'm just never happy with it. And those of you that might be interested in reviewing the book, let me know. And I hope to have this published at the end of the year. Now, my life began as an ophthalmic surgeon, and I was quite a good surgeon. I felt that there wasn't any eye disease that could not be cut, rearranged, and put back together again for a cure. I was featured on the cover of Ophthalmology Times for my surgical skills and contributed a lot to the conventional ophthalmology literature. I had my own surgical center. And then I had a wake-up call. Severe asthma struck me. I was taking 3 asthma medications, and one of the side effects with an asthma medication is a tremor. Can't be a good surgeon if you have a severe tremor. So then I took a beta blocker to get rid of the tremor, but that made my asthma worse. So that was my life. I think I was taking Theodar, I was taking steroids and a Proventil inhaler, and that wasn't controlling my asthma. And I wanted my old lungs back, because at that time, I was running marathons. I did some triathlons. In fact, I did the Hawaii Ironman, and I was in good physical shape. There was no family history of asthma. And I saw some of the top pulmonary specialists, and they all told me there was no cure for adult onset asthma. But then one homeopathic remedy cured me of my asthma. And I had 3 remedies. The first one was tuberculinum, which didn't do anything for me. Nux vomica may have helped a little bit, but Natrum arsenicosum was the miracle worker. It just completely eliminated my asthma, kind of changed my personality and temperament. And that's when I began to pursue the homeopathic application in my traditional ophthalmology practice. I said, my goodness, if, I just bring it in, you have to excuse me, someone's at the door. If, homeopathy could cure a chronic disease like asthma so effectively, why couldn't it help all of my eye patients that I was seeing that I couldn't help? A lot of cases of macular degeneration, cases of glaucoma. Glaucoma, we can help lower their pressure, help stabilize them. But long-term, these glaucoma patients will slowly lose their vision in spite of treatment and surgery. So a little bit about my background. I'm the only eye doctor to be certified, board certified in ophthalmology and homeopathy. I'm the author of 7 best-selling books. I'm the host of Healthy Vision Talk Radio, and I want to send an open invitation to all of you listening. If you want to be a guest on my radio show, I love to interview homeopathic doctors. I've interviewed Carl Robinson a couple of times, and Todd Rowe, and others. It's Sunday evening. Email me, and I'll be happy to give you information about the show. I have a medical license in 4 states. I'm the past president of the Arizona Homeopathic Integrated Medical Association, and I'm on the faculty of the American Medical College of Homeopathy. Now, there's a dramatic increase in eye diseases worldwide. Why is this happening? And I think our homeopathic laws can explain this increase. According to the American Academy of Ophthalmology, age-related eye diseases, including cataracts, diabetic retinopathy, glaucoma, are expected to dramatically increase from 28 million today to 43 million by the year 2020. And these people need help. Traditional Western ophthalmology can produce miracles with surgery, but I'm seeing more and more people who have these chronic conditions. And I'm going to talk a little bit about surgery is not the answer, that surgery can be suppressive in nature. In the archives of ophthalmology, they did a study of over 10,000 patients, and they looked at the incidence of macular degeneration, glaucoma, and cataracts. And macular degeneration has increased 27.1% over the last 10 years. Prevalence of diabetic retinopathy is also increased. So let's look at the normal eye, just to help you review some of the anatomy. In the front part of the eye, we have the cornea, and this is kind of the window of the eye. And there's a lot of pathological conditions that occur in the cornea, such as dry eye, corneal ulceration, scarring, infection, etc. And I have found that, for many of the acute problems, as all of you will probably agree with me, homeopathy works very, very well for acute problems. It's the chronic conditions that we really have to study the case and work a little bit harder. Then moving in to the eye, we have the iris, and there's a lot of conditions, iridocyclitis, iritis, uveitis, where these inflammatory conditions can also benefit from homeopathy. And then we have the lens of the eye. Cataract changes occur in the lens. I have found these to be extremely difficult to completely reverse. Homeopathic treatment can help improve the vision. It may slightly reduce the opacity of the lens. But every time I treat somebody, I like to talk about their functioning vision. So in other words, if they're coming to me and they're expecting me to completely reverse the cataract, I tell them, the cataract is an aging process. It's kind of like you asking me if you could turn your skin, your muscle tone, and your body back to a 20-year-old. I can't do it. But on the other hand, I can do some things to reduce that opacity and improve the functioning vision. Then as we move into the eye, we have the retina, which is a large area of neuroectodermal tissue, and degeneration of that area produces macular degeneration. We have wet and dry. And then we have the optic nerve, which carries all the neurosensory information to the brain. And in glaucoma, because of the increase in intraocular pressure, you get constriction and damage to the small capillaries of the optic nerve, which cause loss of vision. So here is a picture of the retina. The retina has 10 layers. And I think one advantage I have as a homeopathic ophthalmologist, I'm able to look into the eye, I'm able to do studies and pictures to kind of use the characteristics of the retina, maybe to help guide me to a remedy. For example, if a patient comes in and they have, large drusen, which are like a warty excrescence coming from the retina, and they're yellow and large, and it's kind of like a discharge of the retina, I may think of pulsatilla, if it meets the personality. If there's, scarring and atrophic changes, I'll be thinking of different remedies. Of course, if there's bleeding, I'll be thinking of the snake remedy. So as always in homeopathy, there's not one good remedy for any condition. Likewise, in macular degeneration, there isn't one good remedy. But over the years, I have found that when you can really pinpoint the mental and emotional state, that is like 80% of the case. I think that when you can really identify the mental and emotional state, that'll help lead you to the right remedy. So the symptoms of macular degeneration, loss of central vision, is slow, painless, and usually mild. Central blind spots, and the symptoms are usually bilateral. If you base representation on these symptoms, there's only a small handful of remedies, and I think carbonium sulfuratum is the main one that comes up. But I haven't had that much success with carbonium sulfuratum, although a lot of people claim that a repetition of the dose can help, but I haven't seen that much of an effect. So in addition to the drusen, as I mentioned, you have pigmentary changes, you have areas of choroidal retinal atrophy, and all these characteristics can help you guide you towards the right homeopathic remedy. So here's a photograph here. On the left is a normal retina. On the right, you can see those pigmented areas. You can see some areas of bleeding and hemorrhage, which are characteristic of macular degeneration. Two main classifications of macular degeneration are dry and wet. The dry is mainly atrophic changes, aging changes, and the wet, of course, is where you have leakage of edema, blood, exudates, and the diabetic retinopathy is probably a type of wet macular degeneration. There's marked distortion produced by macular degeneration due to irregularities in the retinal surface, and you can see these wavy lines in the vision. Typically, we advise the patient to do Amsler grid testing, where they can monitor the waviness. And of course, another advantage I have as being a homeopathic ophthalmologist, I do a lot of these diagnostic testing to kind of get a baseline. So typically I'll check their acuity, I'll check contrast sensitivity, their ability to see different shades of gray, I'll check color vision, I'll do visual field testing. So one thing as an ophthalmologist, we collect a lot of data points. And these data points are great because then we can go back after our remedies are prescribed or our treatment, and then we can review and actually see the objective changes that take place. Here's an example of drusen. That comes from a German word, Druse, which means wart. And these are leakages, a lipofuscin material which leaks in the retina. And I usually describe this to my patients as your retina is constipated and you're accumulating a lot of waste products. So we need to, improve the circulation and help you detoxify the eye. And here's an example of a retinal hemorrhage in the back of the eye. I'm seeing more and more of glaucoma patients, and glaucoma is a very serious disease because macular degeneration rarely leads to blindness. Rarely. You lose a lot of your peripheral vision, but you lose a lot of your central vision, but you always have peripheral vision. But glaucoma is one disease where you can go totally blind. I'm talking about midnight in the coal mine. And the therapies for glaucoma at best slow the progression of the disease. It's a very serious problem. And in spite of really good treatment, in spite of taking your eye drops and having surgery, most glaucoma patients will continue a slow loss of vision. And I think this is where homeopathy can be a big help. So the incidence of open-angle glaucoma is increasing. Now, primary open-angle glaucoma, aqueous fluid is produced in the ciliary body, and then it flows out of the eye through the trabecular meshwork. So typically the theory is that glaucoma develops, or an increased intraocular pressure develops because there's blockage in the trabecular meshwork, much like a blockage in the drain of your bathtub. Water's going to accumulate. It's going to overflow from the tub, so we got to open up the trabecular meshwork. So most of the glaucoma treatments that we do when you're taking eye drops, they decrease the aqueous flow, which I don't think is the best way to treat glaucoma because the aqueous is kind of essential for the body. It's kind of like the analogy would be treating somebody with high blood pressure, giving medication to destroy the production of blood in the body. So I think what we need to do is we need to look at improving the overall health of the eye and improving the circulation of the optic nerve. So usually the diagnosis of glaucoma is made by elevated eye pressure, although not always. There's a condition called low tension glaucoma where you can have a normal pressure and still lose your vision. So what we do is we have to use other parameters such as visual field changes and changes in the optic nerve to monitor this. Then we have sophisticated testing where we do computerized visual fields. And here's an example of visual field loss in a glaucoma patient. Those black areas are lost. Typically in glaucoma, you get this type of altitudinal field loss. You get changes in the optic nerve on the left. That white area is called the cup. You get an increase in the optic nerve cup. And on the right is a normal appearing optic nerve cup. Now, I'd like to talk a little bit about suppression because one thing I've learned over the years that as we evaluate our patients, we need to look at what treatments they've had in the past and has suppression occurred. And I think, conventional medical treatment, especially for eye problems, are a contributing factor in this suppression and a contributing factor of a progression of disease, making ocular problems worse and worse. Big Pharma, and I don't have to tell this to you guys, I think is the largest contributing cause in eye diseases in our country. Steroid antibiotic eye drops for conjunctivitis, and I believe even glaucoma drops, cataract surgery, retinal surgery are all suppressive. So antibiotics for conjunctivitis, especially steroid eye drops. Cataract surgery, yes, cataract surgery is suppressive. There's been some studies out that indicate that. There's a 6-fold increase incidence of macular degeneration after cataract surgery. Much like the analogy is, if you suppress a skin lesion and the person develops asthma, that's suppression. Well, cataract is kind of like the skin of the eye, derived from the neuroectoderm, and if you suppress that, you're going to get something deeper. And usually it's macular degeneration or glaucoma. Laser surgery is suppressive, and injections are all suppressive. So here's an example of a purulent conjunctivitis. And of course, the ER doc will put them on steroids and antibiotics. Here's an example of a sty. And instead of looking at the underlying cause, which might be emotional, what they'll do is just cut it, inject steroids, and I think all this was leading to suppression. So cataract surgery is the most common ophthalmic surgical procedure done. And I did thousands of them when I was an eye surgeon. I loved doing it. People got instant improvement of vision. But 3 to 6 months later, lo and behold, they started to develop macular degeneration. And typically, I would tell them, well, you're getting older. In addition to the cataract, you're getting these aging changes. But I believe now that cataract surgery can cause suppression and lead to macular degeneration. Steroids also are a problem. And, all the side effects listed, I don't think are really side effects. I think they're the result of suppression. So some of the side effects are increased intraocular pressure, cataracts, superinfections, herpes simplex, or corneal ulcers. All these things can result for steroid eye drops. Here's an example. It was published in the British Journal of Clinical Pharmacology. A patient using nasal steroid drops developed a septal perforation and a case of Cushing's syndrome related to ocular steroids. So never think that ocular steroids or steroid eye drops are benign. They can cause a serious problem. I already talked a little bit about antibiotic suppression, some of the things that they cause, more serious conditions. Also, glaucoma eye drops are suppressive, mainly because they're lowering the intraocular pressure, but at the same time, they're decreasing the aqueous humor, which is essential for transporting oxygen and nutrients to the eye. So if you are lowering or reducing the aqueous humor, which is supplying other nutrients and oxygen to the eye, you're going to develop other problems. And once again, you're not looking at the underlying problem of the glaucoma. So I mentioned, and this may come to a shock to a lot of you, cataract surgery causing suppression. So there was data from 3 major population-based studies were pulled. And the odds of having macular degeneration were found to be 1.7 times higher after cataract surgery than without cataract surgery. And this was published in the American Journal of Ophthalmology recently. Once again, this is not due to complications of surgery, but I believe due to surgical suppression. So, eye anatomy and levels of pathology. So there are 3 levels of pathology in the eye. And much like when we're treating the physical body. We have the superficial, the skin, which is the conjunctiva, cornea, which are epithelial. Then we have the iris and choroid, which are the vascular layers, the mesenchymal layers. And then the retina and optic nerve are the neurological layers. And I think this is really important to correlate these layers with Hering's law every time you're treating a patient. So I don't expect all of you to be ophthalmologists, but in your case taking, you may want to inquire as to the progression of their eye pathology in correlation with other physical problems. And this can kind of maybe open you up to some ideas in terms of homeopathic remedies and suppression. So, searching for the homeopathic simillimum in eye diseases. So, unfortunately, many cases of eye pathology are poorly represented in the Materia Medica. And I've been, searching for other homeopaths that are treating eye cases, but most of the cases, and there's quite a few of them in India, but they're not ophthalmologists. They're naturopathic doctors or medical doctors who have just taken an interest in eye diseases, and I don't think they completely understand the eye anatomy and pathophysiology. Since the eye is derived from the neuroectoderm, I think the skin section of the repertory has important value. So anytime I'm looking in the eye, the retina, and I see certain characteristic lesions, I'll try to find them in the skin section. Also, in Chinese medicine, the eye is related to the liver. So symptoms associated with organs such as the liver can be valuable for the remedy. The emotional states, also very important, which play a big role. And when I'm taking a homeopathic case, I'm always looking at that causative factor, and invariably it shows up very clearly if you take your time that there's always some type of emotional shock, which then can correlate to the remedy. I can remember talking to this very successful businessman who responded well to Baronia, where during the case taking, he was involved with he had macular degeneration, and during my history taking, in his own words, he said to me, I was involved with a business deal with a man I trusted, and I was blindsided. He said the word blindsided. And after exploring that issue a little bit, it led to the right remedy. Now, homeopathy and ophthalmology is not new. New York Ophthalmic Hospital was under homeopathic management. In 1931, they treated over 31,000 patients with homeopathy, offered postgraduate courses. Amazing. There were some good homeopathic ophthalmic journals, and when I was studying homeopathy, of course, not when I was studying, I'm still studying, you always study it. But when I was at the Hahnemann Homeopathic College in Albany, I would make frequent visits to the university and go into their library and review all the homeopathic ophthalmology journals. So let's go on here. And there are many good books, standard works on ophthalmology. And my favorite, this is a list of these books. My favorite is Moffat's book, Homeopathic Therapeutics and Ophthalmology. It's a nice little paperback book, which has a good repertory and Materia Medica. And also A.B. Norton's book, Ophthalmic Diseases and Therapeutics. These are two books that, if you're interested, I'd recommend you pick up a copy. Norton published a series of cases treating cataracts in 1891. It was a retrospective study where he reviewed 295 cases that he had treated using homeopathy. And 100 patients were under treatment for greater than 3 months. And the results were improvement in 58% of the cases, no change in 42% of the cases. And this was remarkable since cataracts don't improve with time. They usually get worse. And these were the top 3 remedies in Norton's study: causticum, calc-phos, and sepia. The majority of cases were helped with causticum. So you might want to keep these remedies in mind. anytime you see a cataract. So also in Compton Burnett's book, The Curability of Cataracts with Medicine, he talked about selection of remedies based on constitution, and these following drugs have been verified: Beritacarb, Calcarea, Causticum, Lycopodium, Magcarb, phosphorus, sepia, silica, and sulfur. Usually when I treat cataracts, I'm looking for the constitutional case, and often one of these remedies will appear at the top of the list. But interestingly, Burnett wrote in his book that these are the causes of cataracts. Now, I know that sugar is a contributing factor, but salt and hard water, that's kind of interesting. So I'm advising all my cataract patients to drink a good pure source of water, maybe distilled water, eliminate sugar, and reduce salt. So now I'd like to share with you some cases. This was rather a dramatic case that I treated early on in my career, and as most of you know, you get the dramatic cases early on, and then it takes years and years before you see another one. This was a 57-year-old radiologist who presented with sudden onset of blindness in the left eye. Very loquacious with pressured speech, gets mad very easily, and he can't stand rudeness. He also has the peculiar symptom that the vision is better in a dark room and worse in the light. Positive for a 5-year history of insulin-dependent diabetes. Vision 20/40 in the right eye and bare light perception in the left eye. And there is no afferent pupillary light defect. The left pupil is slightly larger. And he had a central retinal artery occlusion. And he was lecturing in Pittsburgh, Pennsylvania at the university, and he was seen by the retinal service, and they diagnosed this, but he had heard that I was this homeopathic ophthalmologist, and he came to see me for advice. And I told him I've never treated this condition, but I just took his case history and said, let's give it a shot. And Bothrops was prescribed, and he had a complete return of vision in 3 days and is doing well 2 years later. And George Fitholkas states that this remedy, together with lachesis, arnica, lactrodectus, bacchans, and lycopodium, should be our main remedies for coping within the first hours following heart infarcts and brain thrombosis. Amaurosis is a strong symptom. Day blindness can scarcely see our way after sunrise. So he had that peculiar symptom that his vision was worse in daylight and better at night. And also because of his loquacity, his argumentative nature kind of fitted the snake remedy. Now currently I'm treating this young girl and I began treating her over the phone. This was a 10-month-old girl. The case was taken with the girl's father. She was born premature, and there was a question mark whether she developed some type of eye infection, was treated with antibiotics, but it wasn't really clear. But taking the case, she was very sensitive to the sun, eyes constantly closing, irritation, rubbing the eyes, alert. Pregnancy, the mom had elevated sugar. There was some upset and anger during the labor or the pregnancy, stress and tension in the family, fear of the baby being premature. Mother was also allergic to sunlight. So the diagnosis was congenital glaucoma, and the two main issues were increasing the size of the cornea because of the pressure and damage to the optic nerve. So using these rubrics, mind shrieking, the screaming of the child, marked photophobia, ailments from anger, and the sensitivity to the sun, I prescribed APIS 200C. And this was a couple of months afterwards. telephone. She's lifting her head now. She's opening her eyes, 90% better, not rubbing her eyes. She's much less sensitive to the sun. And he refuses to take her to surgery, which I emphasize that, this is considered a surgical case. And at least she should probably get the pressure checked. But he refused to get the pressure checked and refused to do any surgery. But he did get his visa, and he was coming to the United States to actually do a physical consultation with me, a physical evaluation. In January, she still not has had the pressures checked. She's going into sunlight. She's 94% comfortable in room light, very playful. Haziness is subsiding. And they told me that I had her on LMs at this time. When she's not taking the remedy, she has a negative effect. In other words, she was more photophobia, and the eye appeared to be more hazy. So once again, I told her we need to get the pressures checked, and they're continuing the APIS. Then, let's see, still there was no change here. Okay, then there was an event where they did get the pressure checked. It was higher. She was waking at night. She was waking from the noise at night. She's afraid of the noise, noises of the car, afraid walking on the road. So I stopped the APIS because of this increased sensitivity, and I put her on belladonna LM1. And follow-up, still unable to check the pressure, no irritation in the eye. It was easier for her to get out of bed to go to her mother. Very jolly, more active. She's actually going into the sunlight more, watching movies. One of the problems with congenital glaucoma is the cornea increases in size. So we're kind of monitoring that. I asked him to send me pictures of the cornea. And I really needed him to be able to somehow check the pressure. He bought a home device to check the pressure. And also I wanted him to kind of document what her vision was. So more recently, she's taking belladonna LM6 right now. She's also using Zalatan and Aesop, which the medical doctors prescribed. So there's no pain, no watering. According to her father, her eyes are perfect. She's able to look at the sun. She's a little bit more naughty now. She's craving milk. Of course, she's 3 years old. And so he claims that, as far as he's concerned, she's perfectly normal. So this is an active case that I'm following of congenital glaucoma, and I'll keep you posted on this. Hopefully, there's a good outcome, and this may be a good case to publish. So now I want to talk about some macular degeneration cases. This is a 76-year-old female. She had a recent episode of hypertensive crisis with a reading of 220 over 146. Very anxious about getting her vision back. Over 10 laser treatments in both eyes. Worried about the future. Needs more information. Very questioning everything that I do. Very skeptical. Sleeps with the light on all night. She was robbed as a child and had a fear of robbers. She's afraid that a man will come through the trap door. Let's see, fear that someone is in the room, on guard all the time, sleeps facing the door. She also has a gun, a small lady's gun, which is loaded. She'll sleep for a couple of hours and awake at 2 or 3 a.m. Fears are worse when she was alone. Let's see. The physical exam reveals 5 over 100 in the right eye. That means from 5 feet, she's able to read the second line on the eye chart. And from 5 feet, she's able to read almost the bottom line on the other eye. There's cataracts in both eyes, central scarring in the right eye from the laser treatments, retinal pigmentary changes with large drusen, which I compare them to tumors and warts. So the diagnosis was macular degeneration, cataracts, hypertension, and anxiety. These are the rubrics I used: the face, expression, suffering, fear, being alone, anxiety about the health, anxiety at night, and general tumors. And so I prescribed, there are many aspects of calcarea carbonica and also the marked fear and anxiety of arsenicum album. So I gave her calcareum arsenicosum, LM1. So I've been following her for over a year now. But it took her 2 months before she started the remedy because she had strong fears of an aggravation. But she now feels good, lots of energy, can relax. She has more energy in her business. She's getting compliments on her skin. Her fears are greatly improved. No longer has a fear of being robbed. Fears at night are great. She's happy, more relaxed, his vision improved. And I think, and her vision, really, there was not that much improvement of her vision. Well, it did improve in both eyes, but not that marked of an improvement. But the mental and emotional state greatly improved, and her functioning improved. So that's one thing that I've noticed, is sometimes we don't get a reversal of the actual physical pathology, but we do see a marked level of function. And that's kind of my goal, and my goal even as an eye surgeon. I never talked to anybody about getting 20/20 vision. It was always, let's see what we can do to improve your functioning level. So this is a second case, is a 78-year-old female, macular degeneration, cataracts, and a balance problem. She was told recently she had macular degeneration, vision is very dim, and she has trouble reading. And she has vertigo. It comes on suddenly, and she goes down like a rock. Room spins from left to right, and very debilitating. Quivering like an old lady. She's weak. And this is especially catastrophic to her because she loves ballroom dancing, and she's not able to dance. She also lives in fear. Let's see. Important aspect of her life was ballroom dancing. She's depressed now because she can't compete. She feels hopeless and withdrawn. Sexual drive was never that high. She states that there's a lot of sexuality in dancing. So the physical exam reveals a reduction in vision, more in the left eye, advanced cataracts, myopic degeneration with atrophic changes. So the diagnosis is macular degeneration, vertigo, and cataracts. So these are the rubrics I used. Eye cataract, vertigo accompanied by staggering, vertigo sudden, ringing, mind dancing, and sexual desire diminished. And according to Norton, his homeopathic treatment of incipient senile cataracts, sepia is the #1 remedy to think of in females with advanced cataracts, and that's what I gave her. I've been following her for a couple of years now, but 8-month follow-up. She can read the menu. She had she described it as a 70% improvement of her vision. Street signs are becoming clear. Colors are more vivid, no more dizziness, stronger, more confident walking. And she was back to ballroom dancing. I don't have that comment there. The third case is a 78-year-old female, developed cloudy vision in her left eye. Dim, letters began to run together. One of the biggest difficulties in her life has been her relationship with her daughter. Her daughter cut her off from the family, not returning the letters, hang up. It's been a big disappointment. So, daughter doesn't appreciate anything that she does. So eating, like a physical exam, she has retinal pigment atrophy, vision markedly reduced. So because of this strong attribute of contradiction, intolerant of contradiction, anger at trifles, this indignation, palpation of the heart, I gave her staphysagria, LM1. A 7-month follow-up, peripheral vision is better in the left eye. the right eye, she has noticed an overall improvement. Colors are more brighter. She had a dress that she thought was gray, and now it looks lavender. She's not getting angry as easily. She called her daughter and asked if she wanted to meet her. She said yes, it was a good meeting. So a lot of things have changed in her life, including her vision. So tissue salts can be valuable in treating macular degeneration. Calc fluor is called the tissue strengthener. Calc phosphorica, the cell builder. Calc phosphorica 6X, the nerve nutrient. Natrium muriaticum, the fluid distributor. And recently, I read an article that a low-potency natrium muriaticum may be a good tissue salt for the treatment of glaucoma. And also I mentioned, so you may want to consider these tissue salts as an adjunctive treatment. And sometimes I do prescribe these to patients when don't have time to work on a constitutional remedy or they're just not interested. Carbonium sulfuratum, Dr. Andrew Lang has reported success. He uses 30 cc every day, but I have not seen much of a positive effect with that. Dr. Joanne Miller, good success with Sakali, and I've had some success with that. When I was training with Dr. Ramakrishna, he routinely uses Sinicula and vanadium. I've had some experience in using those remedies. Also, human retina, 5C, stimulates the activity of tissue where it was derived, the 5C. So that is available. In fact, I've made human retina 5C when I was an eye surgeon, and I was harvesting retinas. I had Hahnemann Lab make the 5C for me. So these are the top 12 homeopathic remedies for the eye, and I want to briefly go through them because we're coming to a close on the webinar. Arnica, as we all know, it's the #1 remedy for trauma. Think of it for subconjunctival hemorrhage, ecchymosis, or subconjunctival hemorrhage from coughing, retinal hemorrhage, especially with an injury. And here's an example of a marked subconjunctival hemorrhage. Aconite, conjunctivitis from cold, dry wind. Interesting, when I did a lot of excimer laser uses ultraviolet light. And essentially, we would burn the cornea to reshape it. And aconite was very dramatic in many cases to reduce the pain. Inflammations from injury, also think of symphytum. Hot and dry, red conjunctiva of the lids, profuse watering, photophobia from sunlight, loss of vision after fright. Belladonna, very big remedy, sudden onset of inflammation, pupils dilated and sluggish. I've used this as an acute remedy for elevation of intraocular pressure in glaucoma with good results. Retinal congestion, a branch vein occlusion. I had good success in treating this. Optic neuritis and iritis. And of course, the other characteristics which are usually associated with belladonna, flushed face, and ocular proptosis, photophobia. And here's a case of a branch vein occlusion with a lot of hemorrhage in the back of the eye and inflammation. And this belladonna would be a good first-line treatment for this. Here's the proptosis, protrusion of the eye. Euphrasia or eye bright. I find this to be a very useful remedy in terms of inflammatory conditions of the eye. Both I've prescribed it as an herbal tea and also as an eye wash in addition. So I think when in doubt, if you're not certain what remedy to use for an ocular inflammation, euphrasia is the #1 choice. Mercurius, thin acrid discharge, this vascular keratitis. And of course, sometimes you can't diagnose this with, without using a slit lamp microscope. but you see these little blood vessels that are growing in the cornea, which I think are very characteristic of the syphilitic miasm and congenital keratitis. And here's an example of corneal opacification with these tiny vascular blood vessels growing in. Phosphorus, very big remedy for the eye, especially when they're complaining of lights, hallucinations of vision, colors. Anytime a patient comes in describing vivid colors and changes, I always think of phosphorus. And of course, diabetic retinopathy, #1 remedy to think of in terms of diabetic retinopathy, atrophy of the optic nerve, and a big remedy for glaucoma. Pulsatilla, conjunctivitis, allergies, burning, itching, obstruction of the lacrimal duct along with silica, and yellowish greenish discharges and styes along with pulsatilla. Rust tox, inflammation, this profuse gushing upon opening of the eyelids, big remedy for iritis, rheumatic changes, orbital cellulitis. And Norton has a really fascinating case of endophthalmitis. And this was in the 1930s before antibiotics. And typically, if you see a case of endophthalmitis, you need to be admitted to the hospital with IV therapies, etc., and a major surgical procedure. But he presented a case that was cured, orbital cellulitis cured with rust tox. And here's an example of a purulent endophthalmitis. Ruta is a big remedy from eye strain, close work. Physostigma, Natmur, and Anosmodium are the 3 other remedies, but I love Ruta for eye strain, stiffness of the eye muscles, and disturbances of accommodation, difficulty in reading. Silica, inflammation, obstruction of the lacrimal duct. It's the #1 remedy to think of in a child that has a nasolacrimal obstruction. Ulcers and abscesses of the cornea, and keep this in mind, wounds that heal very slowly on the eye. Symphytum, the arnica of the eye. Typically, I always go with arnica first, and if arnica doesn't work, then I go with symphytum. And here's an example of an ocular injury on the right. Staph aureus, which is the #1 remedy that I use when there's a strong history of indignation, especially indignation with a stye. Works extremely well. Also, lacerated or incised wounds that don't heal are not healing properly. And here's a picture of a stye. Sulfur is a big remedy. Sensation of sand in the eye, blepharitis. Seeing a lot of blepharitis or inflammation of the eyelashes is probably one of the most common problems that we see in ophthalmology. But I'm always concerned that treating the blepharitis will cause suppression. Much like somebody comes in with a skin lesion, you don't treat the skin lesion, you want to treat the person and try to find out what's going on. So in summary, the increased incidence of eye disease, I believe, is related to suppression. And as homeopathic doctors, we need to understand this and look at good old Hering's law when treating an eye disease. The eye is derived from the neuroectoderm, so the skin section of the repertory can be very helpful. And homeopathy is very valuable in the treatment of all eye diseases. So homeopaths, all of you listening out there, should not view macular degeneration and glaucoma and cataracts as incurable. I hope that all homeopaths will welcome the opportunity to help people who are suffering from the effects of these chronic diseases. Do not tell them what many eye doctors have told them: nothing can be done. Homeopathy can help. So begin to look for the simillimum that will improve their vision and their life. So, all of you, I'd like to offer you a free copy of my book. And just go to kondrotbook.com, www.kondrotbook.com, enter your information, and I'll send you a PDF of the 10 Essentials to Save Your Sight. I do have a chapter on homeopathy in the book, but I talk about nutrition and some other things that may be of interest to you and your practice. And I'm excited with my new book coming up, Homeopathic Ophthalmology. I'd like your input. Email me if you have any suggestions or information, cases. And if you're interested in reviewing or reading the book, let me know and I'll send you a couple of chapters. I'm working on it and hopefully it'll be done by the end of the year. So I guess at this point, I am finished, but we could open up the lines for questions.
Hey, Ed, this is Ron Whitmont.
Hey, Ron, how are you?
Good. Thanks very much for that presentation. I found it very interesting. I had a question for you. I get a lot of people who complain of floaters in their vision, and I'm wondering, how do you approach floaters, and do you give them any special emphasis? Do you ignore them? What do you do with those things? Well,
number one, as an ophthalmologist, I need to know the cause of the floaters. Typically, one of the most common causes is a posterior vitreous detachment. That's when the vitreous jelly separates from the back of the eye. Usually those floaters will resolve with time. It's an acute event. They develop a shower of floaters. So you may look at acute remedies that match the symptoms and the emotional state at the time. Acute prescribing can be very effective. The second type is more chronic. These are the chronic floaters that develop. And I think that these floaters are kind of, represent the chronic pathology. They're more difficult to treat, but as you treat them constitutionally, there usually is a resolution of the floaters. So, one of the questions I have is, if they come to me and they're complaining, if their chief complaint is these little annoying floaters, somehow during the course of my homeopathic interrogation, I want to know what are the little annoying things in their life that are bothering them, because that will lead to the remedy. Likewise, when somebody is losing their vision, what in their life they don't want to see. So sometimes that can be helpful, asking us questions.
Thank you. That makes good sense.
Also, detoxification. I do heavy metal testing on my patients, and so many people come to my practice have elevated lead and mercury, and a lot of toxins in their body can, be a cause of the floaters too. So if you're starting them on some type of a detox program or a heavy metal chelation therapy, that can help. A very good question.
Ed, this is Tim Fiore, Chicago. Can you hear me?
Hey, Tim. Yeah, I hear you loud and clear.
Okay. A couple questions, and I had a comment too. You mentioned about suppression. I had an interesting patient. He had chronic blepharitis. I was treating him. He's an engineer in his 40s, early 50s. And it's interesting. At one of the visits, I found that he was using chapstick a lot for his lips. And I told him to stop. I told him to stop the chapstick, and the blepharitis got significantly better. So, I think that talks to suppression. The questions I have, see a lot of, especially in kids, they're diagnosed with conjunctivitis. The school freaks out. They say they want the kid on antibiotics. In my understanding, in my experience, mostly it's usually allergic or viral anyway. What do you do in a situation like that? What I've typically done is say, well, give them the remedy that fits, maybe have them take some Similacin eye drops. But what would your approach be to a patient like that? Could be an adult more often than a child.
I agree with you that, most cases of conjunctivitis are viral. The antibiotics do very little, to treat the problem. I don't see that many kids in my practice, but I would think that acute prescribing for the viral conjunctivitis would be helpful. And, the two remedies that come to mind are the aconite and belladonna, depending on the symptoms. But the acute prescribing, And also, cold compresses to reduce the inflammation, and something like Similacin eye drops to help with some of the relief.
Thank you. The other question is, you mentioned cataract surgery being suppressive, which is interesting. I've never heard that said before, and it's very interesting that you find more macular degeneration after that in the 6 months after. One thing I find is after cataract surgery, the ophthalmologists have this cocktail of eye drops that they give patients for a month. What do you think about that? Is that really necessary? Do you think that causes any problems? I've had patients who have problems because of the eye drops, and when they cut down or stop them, they feel better. And we usually give arnica and whatever other remedies indicated, sapsigria or whatever. Well,
they're giving the eye drops as a prophylaxis so they don't develop an infection. So usually it's an antibiotic steroid combination, which helps reduce the inflammation, give the patient more comfort. So unfortunately, it is necessary that they do take some type of eye drops to prevent an infection, because the eye is very, very vulnerable. The other thing that poses a big problem after cataract surgery, they're putting a plastic lens in the eye. And essentially they're putting this piece of plastic which goes through the blood-brain barrier, and we're knowing that plastic leaches a lot of benzene and phthalate derivatives, which can be neurotoxic. So I think that's a whole another issue about the plastic that's in the eye that can lead to big problems. But there's no question, typically, when I see somebody with macular degeneration, I'm taking my case history. They had cataract surgery years ago. They were happy with the surgery. And then 3 months after, 4 months after, they started getting a little blurred vision. And that's when the doctor diagnoses macular. But even in the traditional literature, they're admitting that there's an increased incidence. So the problem is, I'm not totally against cataract surgery. I think that, you need to, I think most cataract surgery is done because the eye surgeon will say, you have an early cataract, let's get it removed. And the patient really isn't having that much of visual limitation. So, certainly if you have that marked visual limitation, you're not able to function, you need to have cataract surgery. But at the same time, as a homeopath, let's try to find out why the cataract developed in the first place. Then maybe if you treat them constitutionally or with the right remedy, they're not going to develop that sequelae of suppression. The macular degeneration or glaucoma, they'll do better.
Have you seen cataracts go backward or stabilize?
Oh, yeah. Not complete reversal. It's interesting because I've treated many cataract patients. They get an improvement in their vision, but they come to me and go, well, do I still got the cataract? And I look in their eye and I go, yeah, you still got the cataract. And I'm looking and I'll say, the cataract hasn't changed at all. I don't tell them that. But their vision improves. So I think that, the whole visual system is more than the cataract. But, with treatment, you can get an improvement of vision. Some reversal. It's kind of like aging. You get an old guy coming to you with wrinkled skin and, he wants to have everything reversed. You're not going to be able to do it. But the goal is improve the functioning vision. And I think that's what you need to do.
Thanks, Ed. Thank you very much. Great presentation.
Oh, thank you. Well, I guess if there's no other questions, I want to thank everybody for the opportunity.
New York, can you hear me?
Yeah, I hear you.
Okay. So
Not only can I hear you, I can see you. You popped up on my screen.
That's scary. I can see you too. You remember we met up in the mountain resort about 17 years ago. Do you remember that?
Oh yeah, I remember. That was what was the center in the tri-state area of New York?
Yeah. We were both doing lectures to patients that night. Those 2 nights.
Right, and I remember you had a very, very good lecture. In fact, I'm still using some of your material in my talk.
Oh my goodness, thank you. So, first of all, overall, this was a great presentation. Very, very helpful. I have a question about if someone comes to you and they're their eye doctor is suggesting cataract surgery, but their vision is not horrible at that point. Can you suggest to them, well, we're going to monitor your vision, keeping that stable, and make sure the cataract stays stable and watch it for progression? Does that make sense to you?
Yeah, well, that's what I mean, the only indication for cataract surgery is visual limitation, where they're not able to function and do the things they enjoy doing. So there's a trend in ophthalmology now. As soon as they get an early cataract, they want to operate. And, why, I don't know. Well, it's a moneymaker. It's much easier to operate when the cataract's at an early stage. But there are complications. So I tell patients, what's your level of visual limitation? I can still drive, I still read. Maybe it takes them a little bit longer to read. Well, or they need more light. They don't need cataract surgery. Let's eliminate the big three: hard water, salt, and sugar. Clean up their diet. And maybe check them for heavy metals, get them on a constitutional remedy. It may slow the progression. Everybody over the age of 50 has an early cataract. Everybody over the age of 50 doesn't need surgery. I'm 67. I went to the eye doctor, and I have cataracts. But I'm able to function. I read, I drive. And an aggressive eye surgeon would say, oh my God, you got a cataract. We better take this taken care of before it gets harder. It may lead to glaucoma. It may cause inflammation. They use the scare tactics.
Mm-hmm. Great. Thank you so much.
Oh, thank you. Okay, I guess there's no more questions. I want to thank everyone, and go to kondrotbook.com and download my book. And looking for help with my homeopathic ophthalmology book. I've been working on this book, but I'm just never satisfied with it. Always learning something new that I got to include in the book.